Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the scurvy, etiology, pathology, diagnosis and clinical features and treatment. Scurvy is caused by the deficiency of vitamin C causing a defective formation of collagen in the connective tissue, defective intercellular cement, defective dentin in teeth, defective steroid tissue in bone and subnormal platelet stickiness causing capillary hemorrhages, delayed healing and defective formation of teeth and bones. In adults, the tooth may become loose. Clinical features: adult scurvy. The hypertrophy of the gums sometimes may form scurvy buds, may project beyond the biting surface of the teeth. The swollen gums are livid in color and bleed on touch. There is always some infection causing scabitic gingival appearance, offensive fetor, cutaneous bleeding. Usual site is the lower thigh, above the knee. These are perifollicular, tiny and around the hair follicle. The follicle is a bit raised and appear like folliculosis. The hair from the follicle appears like a corkscrew hair. The hemorrhages then appear on buttock, abdomen, legs and arms, followed by petechial hemorrhages. Pruritic spots are first seen on the ankles and feet. Later, large bruises may develop anywhere on the body, called ecchymosis, usually in the lower extremities. Woody leg. Hemorrhages may occur in the joints, nerve sheath, under the nails, conjunctiva, gastrointestinal tract, or there may be epistaxis. Lastly, the patient is anemic. The prolonged cases, osteoporosis of the spine spine is reported. Before the symptoms appear, the patient may become weak, listless, without any reason. Infantile scurvy, lassitude, anemia, painful limbs, enlargement of osteochondral junction. Scorbutic infants may not develop gingivitis due to absence of teeth. Gums have classical appearance of scurvy buds. First hemorrhage is a large subperiosteal hemorrhage overlying the long bones like femur. Frog leg position. The limbs are painful, especially on moving. The infant may be crying continuously, agonizingly, and scream even louder when lifted. Diagnosis. It is to be distinguished from the non-specific gingivitis, Vincent's stomatitis, lead poisoning, gingivitis due to hydantoin derivative drugs, other types of purpura. Infantile scurvy may be mistaken for rheumatic fever or osteomyelitis. Poliomyelitis. Specific investigations. Estimation of serum ascorbic acid, vitamin C concentration in the white blood cells or platelets. Treatment. Parenteral treatment has no advantage over oral route. Synthetic ascorbic acid should be given at once in adequate amounts. The aim is to saturate the body with the ascorbic acid without delay. The normal body ascorbic acid is 1.5 grams. So 250 milligrams oral 4 times a day will achieve this within a few days, in spite of the urinary loss which quickly follows each dose. In case of synthetic vitamin C is not available, fresh fruits, vegetables, sprouting peas or extract of the pine needles. Once a danger of life is averted, attention should be paid to correction of the general deficiencies of the former diet. If anemic, iron and folic acid is given. Prognosis, which with adequate treatment the recovery is rapid and complete. Prevention, fruit juice should be given to the infants for the first 2 years of life. In people who are non-cooperative for taking natural sources, giving 25 milligrams daily or 500 milligrams synthetic every month can be beneficial. For explorers of armed forces in the territory, should be given tablets. In conditions like drought, anti-scorbutic remedies can be tried like scurvy grass, Cochlearia officinalis, pine needles or traditional remedies. Sprouting beans made to germinate by spreading the pulses under the wet clothes. That's all about the scurvy, and in the next video I will discuss about some other disease.